The president's proposed fix to Obamacare is not only controversial, it is costly, too. Mr. Obama is asking insurance companies to temporarily reinstate policies that were canceled because they did not meet the stricter requirements of the Affordable Care Act. But that could come with a huge price tag. CNN's Joe Johns is looking into it for us. Joe, how much is it going to cost us?
Well, Jim, $11 billion is the number to watch. That's the amount of money the government says it expects to pay out in 2014 to essentially underwrite insurance companies that are losing money because of the high-cost customers, including the old and the sick. In order to pay for that, the government was going to balance that out and said it would take in $12 billion next year from fees to insurance companies that were making good money by writing policies to low-risk consumers, including the young and the healthy. The question is whether the president's new fix is going to upset the apple cart, Jim.
So to understand the math here, why would that happen? Why would those numbers change by delaying those cancellation notices?
You know, it's actually pretty simple. If lower-cost consumers, for example, younger people with fewer insurance bills decide they're going to stay with their old plans next year, but consumers with higher medical bills decide to go with Obamacare, the government could end up paying out more than it expected, according to the American Academy of Actuaries, which sent out a warning letter about this just yesterday. The White House and the press secretary says it's really no big deal. Listen.
The reports in the press vary widely. I think it's important to note that when you look at the number of people who would, for example, get benefits in the marketplaces, tax credits and the like, it's like 17 million, and I think the largest number I've seen in terms of cancellation letters is 3.5 million, and I don't even know if that's accurate.
So, Joe, let's say that Carney is wrong there. Just how much money are we talking about?
That is the billion-dollar question. So far, no one we've talked to can tell us that number, but the American Academy of Actuaries has warned that the president's plan to give states the ability to reverse health insurance cancellations could increase costs to the government. How much? They won't say. The problem is it's just hard to project who's going to get into Obamacare and who's going to stay out if they're allowed to keep their plans for another year, Jim.
Absolutely, and that's a big problem because Obamacare sold in part by saying it's going to save money in the deficit. Thanks very much to our Joe Johns. House Democrats are taking cover from expected fallout from the problems plaguing Obamacare. More than 36 voted with Republicans to approve a bill that would allow insurance companies to continue offering policies that fall short of Obamacare standards. Republican Congressman Fred Upton of Michigan wrote it. He joins us now live from Capitol Hill. Congressman Upton, thanks very much for joining us. Your bill passed in the House, but it would be dead on arrival in the Senate, and the White House will veto it. Explain to us how this will be different from your failed attempts in the past to actually repeal the entire Affordable Care Act.
Well, Jim, let's see what happens. I mean, you got to remember that we passed this by more than 100 votes this afternoon. The other thing is that earlier in the week, we had at least, probably by everyone's estimate, at least 100 Democrats that I think were willing to vote with our bill. So we would have had over 300 votes for this, and that's finally prompted the White House then yesterday afternoon to announce this administrative change that they're trying to do. But until then, they were ready and willing to let literally millions of folks who were going to lose their individual policies, more than 250,000 in my state, almost 250,000 in my state of Michigan, to go over the edge, to go over the side, disregard the promise that the president said you can keep your health care if you like it, period. Don't have to do anything if you like it. They knew, in fact, it was different for years. And yet, until they saw that we were going to have some 300 votes a couple days ago, they were just going to sit on their hands. So we've raised the specter of debate, that's for sure. I don't know what the Senate's going to do, whether they pass any legislation or not. We don't know what the White House, and that's just down this way, which is why I went that way with my thumb. I don't know what they're going to do with this administrative fix that they're trying to impose on it. But what do you tell the millions of folks who all of a sudden they've lost their policy? The premium is going up by maybe 300–400%. The deductibles are going up in the thousands of dollars. Yesterday, we had almost 100 House members just read letters on the House floor from the mail that they got from their insurance companies canceling their policy. It's not right.
Well, but let's get to the core issue here, because in the past, your position has been you want the entire act to disappear. You voted against it. You've, in fact, sponsored legislation to do exactly that. Now you've brought new legislation which modifies it but keeps it alive. Are you saying now that you're in favor of Obamacare as long as it is changed in this way?
We'd like to repeal it. There's not a Republican out there that wouldn't like to repeal it. We'd like to see that happen. But we also know that, you know, as we came back from our districts last week, grocery store, veterans events, service clubs, someone was at every one with a letter, a cancellation letter, wondering what the heck they were going to do. And so that's what our legislation did. It allows it to, if you had an insurance policy, individual policy at the beginning of the year, that qualifies you. You can keep it, like the president said. You're not going to have to pay a penalty like, you know, the president, I guess, is still going to impose that on folks at some point here early in the year. And at the end of the day, we were bipartisan, but we have lots of issues to look at. Look at this rollout. The websites still having enormous problems. We're going to have a hearing next week in our committee relating to the security of the information that the individual themselves actually puts into that website. Their Social Security, their income levels, all of that. There's no reason for us yet to be convinced that, in fact, it's secure. What are the providers going to do? I met with some of mine back in Michigan last week. They don't know how they're going to, when people show up in January for services, doctors, physicians, hospitals, are those people really covered? How are they going to get paid? This is a mess. The administration told us from day one. They looked us in the eye. They said, hey, we're going to be ready. Not the case.
Congressman, to get at your actual goal here, you say that the majority of Republicans, yourself included, want to have this repealed. You know that Nancy Pelosi, the minority leader, has said that this is a Trojan horse, in effect. I mean, are your intentions here to torpedo this bill, to make it unworkable, in effect?
Look, we're waiting to see what how the administration is going to do this. They told us it was going to work. It hasn't. They told the American public they'd be able to keep their plans. We know that for millions of folks, that's not the case. We're trying to remedy some of these situations and not leave our constituents high and dry with nothing to show for.
One question we've been asking, you're from the great state of Michigan, are you going to take the subsidy, the workplace contribution from the federal government, or not, to demonstrate your opposition to this going forward?
Well, as you know, members of Congress are included in the Obamacare, President's health care bill, so we will lose our federal employee health care benefits. It puts us into the D.C. exchange. I've not yet explored what those options are. My personal staff will be in that as well. I also know that there's a court decision that will be probably out perhaps in the next couple of weeks relative to whether or not there can, in fact, be a subsidy for for any of the workers that are in these state exchanges. We'll see. I don't know.
Okay, well, thanks very much, Congressman Upton. Sponsored a bill today, got 39 Democratic votes.
And won by more than 100. That's the key.
Well, we appreciate having you on today. Coming up, a deal on Iran's nuclear program.